We are live at United Nations headquarters. Happy New Year to everyone. We have a special guest today, Affan. He's been traveling around the world working on global health. So we want to bring the issue of Goal 3, which is health and well-being. Hi, Affan. Tell us about your work.
Hi, Nishat. My name is Affan Sheikh. So I'm trained as an epidemiologist and health systems strengthening. So what that means is whenever countries are experiencing any emerging health threat, I get to go in and kind of help the country develop the capacity to prevent, detect, and respond to those health challenges.
And so what are some of the countries that you worked so far?
So I've been very fortunate in my career so far. I've worked in 22 countries, spanning from Southeast Asia all the way to through South Asia, the Middle East, and Africa.
And tell us some of the projects and what you have seen. And you also worked with the refugee population, right?
Yeah, so one of the primary focuses of my work is supporting vulnerable populations. So refugees are considered a very vulnerable population since they've been displaced from their homes. So some of the health threats they face are probably things that we take for granted in terms of access to healthcare, basic things like checkups or even like routine routine care for, say, a mother. These things for refugees are a lot difficult since they're displaced and typically on the move or living in camps with very poor hygiene. So in my work, I support ministries of health in developing capacities to bring health and increase health access to these populations. So I've worked with the Jordanian Red Crescent to kind of develop out some programming to help kind of bring access to these populations and kind of help them in terms of the health that they're able to access in this like very, very difficult situation.
And recently you've been working with the antibiotic resistance. And what have you seen if there is any, it's the situation in vulnerable communities, are they getting better over the past 10 years? If we talk about reaching the Sustainable Development Goal 3 by 2030, what are your observations from the field?
Sure. So I was lucky enough to just come back from a 3-month trip where I visited several like high priority countries that are facing basically an antibiotic crisis. So when it comes to antibiotic resistance or AMR as we call it, it's probably one of the biggest health challenges we'll be facing in the coming decade. And basically what it means is the drugs we're intaking are becoming less and less effective. So something that you would easily be able to treat like a few years ago now is you're going to for second or third or even final line drugs, which means the bugs themselves are becoming more and more resistant. You could think of it as in terms of they're becoming more powerful, and basically it's part of their mutation. The genetic DNA within the bug mutates and is able to develop this resistance. So this is especially important when you're considering vulnerable populations, because the most likely places where this resistance is spreading is in communities that don't have access to drugs. So some of the contributing factors for AMR is basically not having access to the drugs or not being able to afford the full regimen. So oftentimes in the most poorest communities, they'll start the drug regimen, they'll take a few tablets, and then they'll start to feel better. And since they can't afford these drugs in the first place, they'll stop mid-treatment and either return the rest of the drugs or just get rid of them.
Wow. And what are the hopes and how you see the future of this situation?
So part of my work is working with the United Kingdom Fleming Fund, which is a large sum of money that's been devoted to this issue. And part of this work is creating awareness and kind of mapping what we know in terms of what's going on in these countries. So that's the first step. And once we know what's going on, we could better prepare policies and regulations that can help control the drugs And one important aspect that I didn't mention is in a lot of these communities, there's a big counterfeit market. So the drugs that the more vulnerable populations are getting may not even be authentic drugs. They may be produced on the black market and sold, and very much like ineffective. But it's the cheapest solution that's available to them. So by mapping out kind of what data is available and figuring out what's happening on the ground, we're able to kind of get a better sense and develop policies and interventions based off of that.
And you say you have done some of the work that trained the healthcare worker and physicians in the local community. So tell us about it.
Yeah, absolutely. So this is a really exciting project that I'm working on with Africa CDC and Emory University. So when we're talking about the Sustainable Development Goals, we can't achieve them if we don't have the manpower to do so. They're very ambitious goals, and rightfully so. And to achieve them, we need trained professionals on the ground with the ability to make that happen. So part of this project is supporting the Africa CDC develop the Institute for Workforce Development, which is basically a way to help reverse and ultimately equalize brain drain. So currently what we see happening is experts and kind of the highly trained professionals from developing countries, they tend to leave their country for a variety of reasons: better economic opportunities, freedom to express their religion or whatever they want. And typically they move to the West. And that's what we call brain drain. So the idea behind the Institute for Workforce Development is to develop the opportunities and training to provide the local health professionals in these countries throughout Africa with the opportunity and training to kind of grow in their role. And ultimately, our hope is, instead of seeing a brain drain, we'll reverse that. So we'll be able to attract back health professionals to come back to their home countries and contribute to the healthcare system, and then maybe even equalize it. So the idea behind that is, instead of seeing brain drain where it's very one-sided, we'll have experts coming from the West to Africa to kind of contribute, and then vice versa, experts coming from developing countries in Africa and across the world coming to the West and basically cycling through.
That's awesome. What you said, it's like to reduce the gap, we have to bring experts from both areas, the East and the West. And what we can do from here at the United Nations to, raise awareness or to help in this, to help aid, working for those who are in vulnerable communities.
Yeah, well, the United Nations is an extremely valuable platform. It's where basically the entire world gathers, and kind of whatever is discussed here becomes a priority for the rest of the world. So I think utilizing that platform to kind of raise awareness about these issues, whether it's antibiotic resistance or kind of workforce development, this is the perfect platform for that to happen, and kind of for those discussions to be started, and kind of the leadership to be formed around, like, to basically champion these ideas and these issues and kind of lead the charge. I think the United Nations is an excellent platform for that.
Thank you very much for joining us today. And I'm Nishad Mirza. You're watching Turkish Journal.